Dear colleagues, this is an unedited surgery of an intumescent cataract. Let us see the surgical steps. By this time, the main incision has been placed. It is a 2.8 millimeter main incision, and one side port has been made on the right side of the main incision. And now at this moment, the left side port has been made. Now, trypan blue dye is used underneath an air bubble. This is the air bubble which has been injected into the anterior chamber. I use trypan blue dye underneath this air bubble. Here it is. This is 0.06% trypan blue dye. Now, after 5-6 seconds, this dye is washed out. I use a Simcoe cannula to wash the dye out of the anterior chamber. Now I inject viscoelastic substance. This is HPMC, hydroxypropyl methyl cellulose. Yes, I do not use any cohesive viscoelastic substance like sodium hyaluronate in intumescent cataract. Now I have incised the anterior capsule and see what has happened. A lot of oily fluid came out. I expressed out those oily fluid through the main incision, and I'm doing this very small rhexis. I call it a mini rhexis. That's it. Now I use Simcoe cannula to aspirate some peripheral cortical lens matter. You can use a bimanual IA or a coaxial IA or just simple irrigation to remove some cortical lens matter from the capsular bag. Lot of superficial and peripheral cortical lens matter will come out if you just irrigate it out. Now, as I aspirate some lens matter, the intralenticular pressure decreases drastically. Now, viscoelastic substance against the HPMC has been injected. And now I take a Vanna scissor, make a small cut at the margin of this mini rhexis. And now I take Utrata forceps again and enlarge this rhexis into an optimum sized rhexis. Thus, I get a very nice almost circular rhexis in most of my intumescent cataracts. That's it. Now is the time to enter into the eye with the tip of the phaco handpiece. There is no need to do hydrodissection. Hydrodissection has already occurred. Now, this is the easy tip of Oatley Cataracts 3 phaco machine. In this case, I have planned to chop the nucleus into as many fragments as possible, and then after chopping all the parts of the nucleus and making all the fragments, I've decided to emulsify each fragment. So one by one, as I rotate the nucleus, I'm making chops, slicing the nucleus into several fragments, almost 6 fragments. Now each fragment is emulsified and removed. In this case, the phaco power was 70%, flow rate was 45 ml per minute, and vacuum is 450 millimeter of mercury. This is the last but one fragment, and I use continuous mode. That's it. The nucleus has been managed. Now I inject a little bit of viscoelastic substance to maintain the anterior chamber while I remove the cortical lens matter. I'm using a Simcoe cannula 23 gauge to remove cortical lens matter. This very simple instrument works very well in my hands. You can use whatever works good in your hand. You can use a bimanual IA or a coaxial IA. The idea is to clean the lens matter very nicely. That's it. The lens matter has been cleaned, and in this case we see that there are a lot of air bubbles. Now how to remove these air bubbles? If I just irrigate BSS in the anterior chamber, this air bubbles will come out. Now I am going to polish the posterior capsule. With bimanual IA. I'm going to implant the intraocular lens. This is a hydrophilic acrylic intraocular lens, and it has been implanted under irrigation. That's it. Since there is no viscoelastic substance, I have saved the time of removal of viscoelastic substance. This is moxifloxacin, a little bit of it. Now I hydrate the side ports. And now I wash the antechamber with BSS after hydrating the side ports. This is a view under higher magnification. The microscope being used is Leica M651. I form the antechamber like this and conclude the case. Hope this video will help you in developing your surgical skills.